you don't expect to get a call that early unless it's bad news. And he said, it's the worst possible.
I mean, the initial thoughts obviously were, it's pancreatic cancer, that's not good. Normally, you only get about 6 months to a year once you get diagnosed. And so we were prepared for the worst, but after I started the treatments, things went very well.
When he came to me, he had no evidence of disease, which is very unusual for folks who present with stage 4 pancreatic cancer. And so we said, well, if it's not broke, we don't need to fix it. He tolerated the treatment very well, and so we continued to give him chemo every 3 weeks.
Well, life outside of the treatments has been pretty normal. We've tried to go places that we both really, bucket list kind of thing.
When you're going through this cancer journey, you need to refill your tank emotionally. And so him being able to travel, or other patients, every day that goes by, I have patients who say, can we work around this event? And always our answer is, of course.
I've been really fortunate with
Very blessed.
doctors and with the nursing staff.
They've all been extremely supportive, some of them become pretty good friends.
I know how much he loves to play golf. I know how much his grandkids mean to him. As you get to know somebody, it becomes much more about who they are as a person rather than who they are as a diagnosis. One of the things that distinguishes us is that we say that we're high tech and high touch. And what that means to us is we don't just provide the physical needs of the patient. Obviously, there are a lot of places that can just give chemotherapy infusions. What we try to do is rally around patients and provide for their emotional needs and their spiritual needs, because obviously being a Catholic healthcare organization, we take that very seriously as well. So our patients become like family to us.
For a city the size of Greenville, we are so blessed to have the facilities and the talent, and not just from the doctors and the nurses. Everybody at the hospital is really caring.
Cancer is not a death sentence. But even in cancers that cannot be cured, like Eric's, his cancer has been managed successfully for 6 years, and there's no end in sight to that for him.
We just would hope that, if it touches one person that has a bad phone call, that they give it a chance.
There's always hope. Miracles do happen. I think about it as, having been around for 6 years is kind of a miracle. It doesn't usually happen with this type of cancer, and you just never know.